drug abuse, cancer,
measles, diabetes, AIDS, cancer.
Good evening once again, everybody, and welcome to our regular Tuesday evening program, Doctor on Call. And we did say to you earlier that we will be continuing from last week. Last week we had the Pharmacy Council here with us, Dr. John. She's back. However, this evening we have with us Dr. Marsha Ducreay and also Mrs. Lydia Andrew Duncan. She's a pharmacist. Dr. Ducreay, gynecologist, and of course Dr. John, she's of course practicing physician. This evening we're going to continue to speak a bit about the council. More like a refresh of what we discussed last week. I do have some more questions for them, and then a very important issue we're going to touch at some point in the program on the issue of vaccination, among other things. So we welcome you, and of course our viewers on GBN Television 711, also our listeners and viewers on our Facebook page and the YouTube channel, and of course our listeners of K105 FM. So we'll start to my immediate right, and welcome back, Dr. John. Doc, good evening and welcome back.
Hello, good evening, Godfrey. Thank you for inviting me back. And I guess we're going to pick up from where we kind of left off for the benefit of those persons who were not on last week. We were speaking about the council, that the council has been reconstituted. That's a pharmacy council. And letting folks know that we're basically a regulatory body. Today, Mrs. Duncan, who is here with us, she's a member of the pharmacy council. Yes, she's a pharmacist by profession, but she's also a member of the council. And our job is to regulate things, to lift the standard of the profession per se. Not just pharmacy, but that relationship between the doctor, the pharmacist, patient, and everyone, and everyone who is involved in that business. So we're not there to, as people might say, to clip anybody's wings, but it's just to ensure that what reaches the patient or the consumer is of a high standard. And to that regard, we have to put things in place in keeping with international standards.
Yes, indeed. So also we'd like to welcome Mrs. Duncan. Mrs. Duncan, welcome. Is it your first time on Doctor on Call, or you've been here before?
No, it's not my first time. I've been here before several times.
Yeah, okay. But your first time with me on the program? Yes. Your first time with me.
I think it's first time.
Usually with
probably with Joseph. Yes. Right. Wonderful. Well, it's a pleasure to have you back, and of course, I have a lot of questions for you. So I hope you have the answers. And of course, joining us on Zoom as well, Dr. Marsha Ducreay. Doc, good evening and welcome to Doctor on Call.
Well, thank you so much, Jeffrey, for inviting me for the very first time on the program. As a physician in Grenada, I've always been listening to the program, but I never took part in it actively, and it's a great pleasure this evening to actually take part.
Right. Well, I can tell you one thing. Usually, once you come on, there's no getting out, because I'll be calling you again.
Well, no problem.
Dr. John here can bail me out on that. She knows. I'll be calling you again.
All right.
So, we're going to start with Doc. Last week we spoke quite a bit about the council. Let me say this, or ask you this. With what is happening with the council now and trying to put regulations in place, what sort of feedback have you gotten from pharmacists? Have you been able to hold discussions with pharmacists and to sort of formally let them know, look, we are putting things in place so that we can keep the profession at a very high standard, or the standard where it's supposed to be?
Okay, we have to some extent, all right, but because we're still working on some of the regulations, we have not been able to engage them with regard to that. But they are aware of all the do's and don'ts with regards to having a pharmacy established. We are inspecting a lot more and putting those things in place. But in terms of all the regulations, we have not gotten to that point. But in terms of engaging some of the pharmacists in terms of training, because remember, training is part of what we are responsible for.
Right.
So we have the internship program, and pharmacists are involved in that.
Right, lovely. And you did share with us last week the component of the council who are involved, and of course what is required, and of course where you intend to go. Now, just briefly, in terms of the responsibilities of the pharmacist, what is the expectation of the council?
High level of professionalism, excellence in performing their duties, which most of our pharmacists are already, engaged in. All right. So, okay, the pharmacist is not just someone who will dispense. Okay, some people believe that, okay, the pharmacist is there, just you come with a script, you hand it to them, they look at it, they try to decipher what is there, and they count some medication and they hand it to you. No. Yes, that is part of their job, but the pharmacist is also an educator, because most times before a patient gets to the doctor, they go to the pharmacy. They will go and say to the pharmacist, look, so. The pharmacist is somebody that some people confide in. And hence the reason when you have a pharmacy, there is usually a little section where someone could do a one-on-one with the pharmacist.
Right.
So they may not want to go to a doctor, or sometimes they may not have the money to go to the doctor, so they go to the pharmacist and they will say, look, this is what is happening, so what do you think? Now it's then up to the judgment of the pharmacist to decide, is this something I should deal with, or is this something I should send to the doctor? And in most cases, based on my experience, some of the pharmacists will advise accordingly. There are some who will go ahead and, just dispense, give a medication. But some of them will say, I think this is something you probably need to see the doctor for. Right. And we are seeing more and more of that now. I found, I'm not sure if it's because I'm more in tune with the council and what's going on, I am seeing more of that. But generally, they will say, look, I think you need to go to the doctor. Or sometimes it's something simple that they can handle. And they may tell you, well, I think this is so is the case. Like a patient goes and they say, look, miss, pharmacist, I have diarrhea. What I could take for that? It may not be a big thing. The pharmacist may ask, you have fever with it? You have vomiting with it? And depending on what the answer is, they may decide, well, let me give you some rehydration salts, let me give you 2 Imodium, and if you have cramps, give you something. That's okay. Right. But the patient who comes, I have diarrhea, 10 for the morning, it's have blood in it, I have a fever. No. Let's go to your doctor.
No, Doc, you just did me a little injustice because you answered about 3 of my questions. I don't know what I'm going to do now.
You're going to find more.
I came with my list, folks, and
there is a whole lot.
Yeah, she destroyed 3 of them in just one.
There's a whole lot more questions.
That's all right.
Well, remember, you gave me a broad question, so I gave you a broad answer.
Right. But you mentioned something very significant there with the pharmacist exercising judgment. Now, if in the course of that, so someone goes to Mrs. Duncan and says, Mrs. Duncan, I have this, I have that, I'm not feeling well, and Miss Duncan probably knows that, this is a little out of my league, and you should probably go to the doctor. But nevertheless, I'm going to go ahead and give you something, and that is a little transgression with the profession. Now, where the council is concerned, what should happen in a case like that in terms of, let's say, the pharmacist not following the proper guidelines as it relates to dispensing medicine?
Okay, well, first it will have to be brought to the attention of the council, because certain things happen and the council may never know. So unless something really grave turns out to be the result of this, and council has to get involved, then we, according to the powers vested in the council, we will be able to address the matter with the pharmacist in question.
Right. Very good. So I am at the pharmacy at the same time, and I know what the patient is asking for. Needs a prescription, and I see Mrs. Duncan give the patient that medication without the prescription. What should I do? Should I call you?
Call the chief pharmacist.
Let's bring Mrs. Duncan here. Mrs. Duncan, what should I do if I find you transgressing like that?
Mr. Council, you have me cracking up because first and foremost, based on the confidentiality code, I don't think you may be able to see exactly what I'm giving to the patient or what I'm discussing with the patient. I'm not saying it may not have happened, but I'm saying it shouldn't be happening. That I'm speaking so loudly to my patient that you are able to hear what we're talking about, or I'm explaining so loudly or so openly that their business is what we would say on the street. And that should not be happening. The profession requires of us patient confidentiality, and if that is upheld strongly, you shouldn't have access to my patient's private information so that you can bring a complaint.
But you know, I'm in the media, and you know, the people like us, we're very nosy. We pay attention to any and everything. So yes. But there's another and Mrs. Dr. Ducreay, we know you there. We're coming to you because we have a lot of questions for you. But there is something that crossed my mind earlier today. I was thinking about the program, and there may be an investor, someone who decides, look, I'm going to get into the business. They're not a pharmacist, but they do have a pharmacist that works with them and who's practically in charge of the pharmacy. And you know, we're going through COVID times, business is sort of slow. Of course, an investor, they're in the business of making money. The pharmacist is at a different level because she understands, look, this is medicine, there are consequences, so I need to do the right thing, follow the guidelines and the regulations, and ensure what has to happen. So it's a young pharmacist. She just came from school, and you know, she's new, so she gets a job, and she's doing a job, and someone comes in and says, look, I need you to give me this, and the pharmacist says, look, no, I can't do that. You need a prescription, so you'd have to go to your doctor and then come back. And the owner says, well, no, give him. I mean, we have to make money. What should that pharmacist do in a case like that? Because things bad, business has been slow.
Well, I will answer because I mean, it's right in my domain. In that case, the pharmacist has to stand their ground because as a professional, you have the responsibility for the safety of your patient, and you also have the responsibility for the care of your patient. And not only that, but as a professional, you are the professional. You know what your limitations are within the profession, and you are not to take instruction from anyone who is not authorized to give you instruction as a pharmacist. As a pharmacist, we are pharmacists. We are authorized to take instruction from the doctor.
Okay.
And if the owner of the business is not a doctor, and even if they may be a doctor, based on what they might be instructing us to do or to give, may have certain special requirements, like it might be a controlled drug, or it might be something that need a prescription or a different treatment. We have a responsibility to say no.
Okay.
And we should say no.
But as your employer, your job is at risk. You've just come from training and everything like that. You're fresh. You're just getting in.
No, your job is not at risk. Because you as a pharmacist, it's a specialized job. No one could do it if they're not specialized.
Okay.
You have to study for it. You have to equip yourself to do it. And you cannot just walk down the road and replace a pharmacist today or tomorrow.
Okay.
And I can tell you, in Grenada, there is pharmacist shortage.
Right. Yeah, I learned that last week from Dr. John.
So you have to do what's professionally ethical for you, for your patients, and you have to keep the standards of the profession high. It's a prestigious profession. It doesn't always get the recognition that it needs or the props or anything that it needs, but it's a profession of service. It's a profession of passion. And once you feel passionate about what you're doing and you love it, you will do what's right. And even if it may cause some turbulence, you would realize that your patients will end up trusting you for it. The owner himself, after a while, might realize, listen, I've got a good pharmacist. Regardless of if they're trying to have their own way up front, they would realize in the end that, okay, they may have saved me from this, that, because something may happen down the road with somebody else, and they might say, that could have been me, And it gives them a rude awakening. So I believe personally you should hold the
ground and do what has
your
to be
standards
done
of your profession.
But in a case like that, if the pharmacist is pressured, does the pharmacist have an obligation to report such behavior to the council?
That's right.
Okay.
Definitely.
And Dr. John, what would the council do? What actions would the council take?
More than likely, the council will call in the individual concerned, the proprietor owner of the pharmacy. We will enlighten them on the act and what the act says with regards to that, because most pharmacies should have a copy of the act. I am, not sure. I cannot answer 100% whether each pharmacy has one, but we of course will enlighten them as to what the act says regards to that.
Right. Great. So I want to bring in Dr. Ducreay now. And now we're talking medication. Of course, there's prescribed medication, and there's medication that you can go and buy over the counter. One of the very common ones is the morning after pill.
Yes, it is.
Well, I don't know much about it, but I've heard about it. I've heard about the morning after pill. Let's talk a little bit about that, and because this is going to take us into some other areas that we want to discuss. People come and from what I understand, they come to the pharmacy and they buy the pill. Is it something that someone should just come and get like that, or you require a prescription? How should it be taken? What are the dangers involved? So, Doc, maybe I should start. Well, no. Dr. Ducreay. Dr. Ducreay, yes. The morning after pill.
Well, this actually is a very good topic to discuss here this evening, the morning after pill. Well, you find in our medium in Grenada, many of the women in their reproductive age, they choose to go over the counter and have it being bought from the pharmacist. As to respects to the guidelines now, I'm not sure if any guidelines have been given in relation to prescription should be given to everyone, because some of the morning after pills is definitely given as a counseling from the pharmacist, and most of it is regarded as safe, except patients maybe who have been on seizure medications or antidepressants or even HIV medications, or patients who have been severely obese. They could be at risk of taking over-the-counter medications such as emergency contraceptives. So I do think actually a pharmacist just does a very good job by educating the patients about that. Few patients would come to me and ask me the choices that are available. In our medium, actually, there is the tablets and there is the coil that can be found. and they are rather pretty safe. They do have a few adverse effects, and as I said, there are certain population like obesity or patients who are on anti-seizure medications that needs to be a little bit more cautious about that.
Okay, but in terms of taking it, should someone be taking? How often should someone be taking medication like this?
Well, emergency contraceptives, the name speaks. It means that after postcoital intercourse. So there is the coil, actually, most likely the copper coil, that should be taken within at least 120 hours after unprotected sexual intercourse. Or even the tablets, there is levonorgestrel normally that needs to be taken within 72 hours. Or even the Ella1, which is ulipristal, that can be taken up to 5 days after unprotected sexual intercourse. By data and literature, it is advised that actually it can be taken more than once in any cycle, but not within 5 days of taking any one, because you do not want to have counter effects like a lot of headaches or dizziness or fatigue.
Okay, but long-term use of it, can it create any problem for a woman?
Well, definitely it is not recommended for long-term use. Data today, evidence has not shown that there is any risk really, because it has no risk on future pregnancies or even an established pregnancy. But it's not recommended because why? It is used, the mechanism of actions, what most of the tablets that are taken as emergency contraceptives is to delay ovulation, or the coil is to prevent implantation of the baby into the womb. So it's not recommended as long term because first of all, it's used as an emergency contraception just before, after unprotected sexual intercourse, but it does not protect sexually transmitted diseases, right? And also if there's any current sexually transmitted diseases, actually this needs to be treated, so it's not recommended.
Right, but in terms of its effectiveness, is it 100% effective, or can someone use it and still, become pregnant?
Well, there is no medication up to today that is 100% effective. For example, the copper, the coil, it has 0.1% failure rate, so it can have pregnancies. In relation to the Ella1, which you could take up to 5 days after unprotected sexual intercourse, there's 1.4% risk of getting pregnant. And the levonorgestrel, there's 2% of getting pregnant. So you could see that the effectiveness of these medications is above 98 to 99% thus far, right? But they themselves have their own adverse effects. Even if they fail, they may fail very little for pregnancy, but you have people suffering from headaches, low abdominal pain, sometimes irregular bleeding that may happen even up to a month after taking these medications. And very important, this populace needs to be educated that even if you take these medications, which are emergency contraceptions, you can still be pregnant, right? So it's important to educate the patients to let them know that if their period delays more than a week, or they have low abdominal pain, or irregular bleeding during the time when they expect the menses, they need to report for further counseling for possible pregnancy tests.
Okay, thank you very much, Dr. Ducreay. We did take a short commercial break. We're going to take that. When we come back, there are some more questions. I want to sort of connect this discussion with something that we've been hearing a lot, blood clot, and I also want to speak about the vaccines, Doc. And then I'm just allowing Mrs. Duncan to breathe a bit because I have some other questions I need to put at her. So stay with us, folks. We'll be back with you in just a moment.
Introducing Color by Sissons. Citizens.
Level of convenience and comfort awaits you when you shop at Rise and Shine Supermarket and Hardware Supplies, Griffin Lane, Grenville. Convenient, because we are open from 7 a.m. to 10 p.m. Sunday to Sunday. We're even at your service on public holidays. Comfort, because we are easily accessible to the physically challenged. Free Wi-Fi is available while you shop, and bags come at no charge. Everyday low prices and excellent customer care. Adequate parking available. We supply everything you can possibly think of. Family and home supplies, fresh meat, vegetables, and personal care products. All brands of cooking gas at affordable prices. Plumbing fixtures, cutting and grinding discs, PVC glue, drywall screws, and power saw blades. You can send in your order, have it pulled, or pick up express.
Valley Pharmacy offers both wholesale and retail pharmaceutical and over-the-counter products. We have the most competitive and affordable prices. We are the agents for Vit Plus multivitamin for healthy everyday lifestyle and Sanatogen powder. Hills and Valley Pharmacy supplies the best quality, name brand clinical products such as Rescue Oil, Bio Oil, Neutrogena, Aveeno, and Clarisil. We offer the most convenient opening hours. Our telephone numbers are 435-6904 or 6903. Remember, at Hills and Valley Pharmacy, your health is our business. We care.
Now open Hills and Valley Medicare Center, your one-stop for medical supplies, massage therapy, physiotherapy, and an in-house physician. At Hills and Valley, your health is our business.
Hey folks, you're invited to tune in to Grenada Music to the World program, hosted by Eugene Gittens on Saturday mornings from 10 a.m. to 12 noon on Classic Radio 105.5, 105.9, Hot FM 98.5, 98.7, GBN TV, and all their social media platforms. The only totally local music program in Grenada, representing all genres of music. So it's Green's Music to the World on Saturday mornings from 10 a.m. to 12 noon on GBN with the music icon himself, Mr. Eugene Gittens. See you then.
Hello everyone, I'm Godfrey Augustine. This is an invitation to join me this Wednesday for Release It as we go live on K105 FM, GBN Television 7 and 11, GBN's Facebook page and GBN's YouTube channel. Our discussion will be on the issue of treating as cited in the Representation of the People Act of Grenada, Section 89, 1 and 2, which deals with that issue. It is an election offense, and our guest on the program will be Attorney at Law Cara Shillingford from Dominica, Mr. Ruggles Ferguson from Grenada, and along with me will be Mr. Joseph Lane. Be sure to join us this Wednesday for this special edition of Release It as we deal with the election offense of treating. See you then.
Can you spend wisely and have more savings? Yes, you can. Learn more with Money Matters on GBN Television. The Money Matters series explores 12 top ways to save money. In this series, you would learn how to save by setting up your spending money right. Save on vehicle loans, home improvement projects, your credit cards, and even on prescription drugs. Tune in every Tuesday morning at 7:15 for Money Matters, a lighthearted conversation with financial planner Tali Francis. Follow the rebroadcast on Thursdays at 6:50 p.m. and on Sundays at 7:30 p.m. Money Matters is a financial literacy public awareness program sponsored by Republic Bank Grenada.
Republic Bank, we're the one for you.
There's no better way to start your day than with me on Good Morning Grenada. Good Morning Grenada is your one-stop shop. We have information, education, entertainment, your bi-weekly traffic cam, and we link up with the sister isles of Carriacou and PT Martinique. Join me every 6:35 on weekdays for Good Morning Grenada. It's your daily dose of all things Grenadian, mixed with just a little bit of crazy.
Good morning, good morning.
I said just a little bit of crazy.
I tell all of the things that take me.
Good Morning Grenada, 6:35 a.m. on weekdays, available on all GBN platforms. Start your morning off right.
Welcome back, everybody. It's Dr. On Call, and for those of you just joining us, we have with us Dr. John to my right, Mrs. Lydia Duncan, and of course joining us on Zoom, Dr. Marsha Ducreay. We're talking about the council and of course some other issues as it relates to the pharmaceutical profession. Now, there was a question I had to ask. We briefly touched it during the break, and it has to do sort of coming back on the issue of issuing or dispensing medication that is or should be dispensed via prescription and been given to a patient without that. What about a situation, and I did mention earlier, a situation where maybe the pharmacist says no and the owner says yes? What if for some reason Mrs. Duncan had just run to the washroom quickly and someone came in, it's a friend of the owner, he wanted something and the owner said, you know what, let me go and give you. Should that be encouraged?
That's a no-no.
That's a no-no.
I will personally report the owner, even if I work for him, because that compromises the safety of my patient. And for me, my patient is priority and their safety. So having you as an unqualified person to treat with them in such a manner should not be allowed, especially if it is something that is strictly should be given or dealt with by the pharmacist. It should not be encouraged.
Okay, wonderful.
If I may just step in here, I so agree with what Ms. Duncan just said. You remember we spoke about last week, I think we touched about prescriptions that are written and how it is supposed to be written.
Right,
And some physicians are notorious for having horrible handwritings. And all it takes is one letter to be interpreted as a different one, and you may have a totally different drug.
Right.
Some people write by brand, some people write by generic. Okay, and there are some medication that have similar names. For instance, there is a drug called Sporanox, and there is another one called Sporasec. Two different things. When I write those, if I write it by the brand, sometimes I tell the patient, look, this what I give you is a pink looking capsule.
Right, just to be certain.
This one is a kind of green and cream one. So if you get this one, this is not the correct one. Right? So, these are some of the things that maybe the owner or whoever is there at the time may not know. You have Doloneurobion, N, and you have Neurobion. I remember writing Doloneurobion N once, which is for pain. It's a combination of the B vitamins and the diclofenac. And the patient came back and told me, this thing ain't working, they ain't getting no relief from it. I said, let me see what you got. The patient got Neurobion, which is pure vitamin, no diclofenac in it.
Okay.
So the pharmacist plays a role in that. The pharmacist is not a pharmacist for just being a person. The pharmacist is a professional who was trained to do certain things. And if you're not, I don't think you should step into dispensing.
Right.
Okay, so the pharmacist, as I agree with her, has to hold his or her grounds and do what is right.
I mean, medication has different effects. You give someone something that is incorrect, and it could
be a totally different story. You know, you may not understand. Sometimes I may ask a patient what medication you're on. They may not remember. And they may call home and say, look on the dressing table and tell me what is it you see. And the minute they start to call out the spelling of the drug, I know what it is. I say, okay, thanks. Because this is me. I'm writing it how many times per day?
Yes.
So I know what it is. It's familiar territory, as you say. But for someone not knowing that, you go and you fumbling to tell this person who is not a pharmacist, well, I want a refill of this, the little pink tablet. It ain't have no little pink tablet when it comes to that. Yes, every tablet has a color and it has a number on it, and this is something people don't know. So if a patient tell me that, and this, some patients are smart, they tell me, doc, is a little pink tablet and it have a number written 7 whatever on it. I may not remember it, but I could look it up and know what it is. But even then, let me see the package. Let me see the empty package. In the event that you're not my patient, let me know what it is you're on. Okay? Because these things are not things we should be joking with.
Right.
We should take them serious.
Before Mrs. Duncan, I want to come to you in regards to the morning after pill, which I spoke to Dr. Ducreay about. But just before that, I want to briefly talk about that relationship between the doctor, the patient, and the pharmacist. What kind of relationship should exist between these three individuals?
The doctor, the patient, and the pharmacist. It should be a very harmonious one, to tell you the truth. So, in the event that you get a prescription from a doctor, and you, the pharmacist, are not clear, or you misunderstand something, or you have any sort of wavering, your first option should be to say, let me double check with doc. So you pick up the phone, you call, say, doc, listen, I have a prescription here for X person, sometimes the doctor themselves, before you even start to explain, might say, oh, okay, I know what you're talking about, because they may have had a little thing in their head themselves when the patient left their office or something, and they will tell you, okay, all right, this patient, and they tell you how to rectify the situation, right? You may sometimes get one or two doctors that might not be too happy when a pharmacist call because they feel that they would have put everything down properly and you shouldn't be calling because it's there and it's clear. But if you, the pharmacist, is not satisfied, your right is to call the doctor and make sure that you are satisfied before you get to the patient, because you are the final stop before the patient gets the medication and start taking it. Okay? And then you make sure that you now go to the patient and make sure that everything that the doctor wants the patient to have, they have it as the doctor wants them to have it, and exactly how it should be. So you have to make sure that the doctor who has diagnosed the patient, you have to make sure that the treatment for whatever diagnosis it is proper, correct, and well placed for the patient.
Does the pharmacist, in terms of a patient's history, does the pharmacist keep a record of like the patient's visits and history and medication? So, for example, if and I think I'd mentioned something similar last week. If a patient comes in, so you're accustomed, I usually come in and I come to get my probably lisinopril or something like that, and one day I come in and I come with a different prescription. you know that, well, no, that's not what he usually gets, what should you do? Should you just go ahead and dispense, or maybe make a call, or ask the patient a couple of questions to find out why, all of a sudden there is a change in the medication?
Well, your responsibility, if you're uncertain, would be to double check with the patient. Ask them, I noticed, that so is the case, taking something different. Query whether they would have seen a doctor to have the change made, and whatnot. Because what we find happening sometimes, some people self-prescribe, or their friend prescribe for them. They might tell a friend, listen, so I'm experiencing these symptoms and whatever. And then lo and behold, you hear them coming to ask for it. And you say, well, who prescribed it for you? Or how you know to ask for that? And they say, well, my friend have the same symptoms. And then you have to say to them, oh, no. Because we've seen that, and we experience it all the time. I'm sure maybe sometimes some people are so even brave to go to the doctor and say, listen, my friend have the same symptoms, and so your doctor give him this and that, and if you could give me two. They do these sort of things.
Oh, yes.
So you have to be very on the ball. You have to be attentive. You have to be caring, and you have to, sometimes pry, find out what's going on with them, because you could actually save them from some disaster or something, once you show that extra level of concern, where it concerns certain things that you might find unusual,
Right. So let's talk about the morning after pill. We heard from Dr. Ducreay. She spoke to us a little bit about it. I find it very interesting you talk about that. So as a pharmacist and people coming to you to get this, what's the experience like?
Well, what I can say, it's something they can get without a prescription, okay? And it has several uses. They can get it if they've had unprotected sex in a time when they might be ovulating and they do not want to become pregnant, or they do not want someone wanted child or something. It could have been in a situation where there was forced sex, where, for some reason you might have been gone on a date, it gone bad. You don't want to feel the consequences of it later on down the road, And it also could have been because you might have a breakage in a condom or some other contraceptive that you would have been using, and you want to make sure that you're safe. So that could be one of the reasons why you come. But what we've noticed in our practice as pharmacists, some people, as long as they have unprotected sex, they would come to you for a morning after. So you might get some people, if they have unprotected sex 5 times a month, they might come and want to buy 5 times. And so now you as a pharmacist have to be observant, notice how regular somebody is coming. Then you realize, okay, this person is not using it properly. You'd have to take them aside, you'd have to counsel them. You might have to explain to them how the menstrual cycle is and what the morning after does, how it works. For example, the morning after works in 3 different ways. It works by preventing the egg from being released, right? If the egg have time be released, it works by preventing the sperm from fertilizing the egg. Right? It all depends on which stage of the cycle they use it at. And the third way is that it prevents, if you didn't catch it and the sperm have time to fertilize the egg, the morning after works in that case now to prevent the already fertilized egg from attaching itself to the lining of the uterus. So that you don't get a pregnancy. It will just disintegrate and never get out of the body. So you don't want, it's not every day you're ovulating.
Right.
So if you had sex several times during your cycle during the month, you do not need to get an emergency contraceptive. But some people don't understand it, and they think whatever they have unprotected sex, they should get. There are certain safe periods when you can have unprotected sex and not be worried about if you're going to get pregnant or anything like that. Some people don't understand it too well. There are several times I would have had to pull people and show them the cycle and tell them, okay, it's expected within X day or before your ovulation, you can get pregnant, and how much days after, because the sperm stays alive for how long and the egg stays alive for how long, and you let them get an idea as to what's going on, and then they manage themselves better because they're now informed and they have the information, so they know, okay, I'm not going to get this now because I'm in a safe zone or so. So you have, as a pharmacist, you have a lot of counseling.
Right. Okay. So I'm glad you mentioned that. Doc, I'm sure you've been following what Mrs. Duncan said, and she mentioned not every time you are involved in intercourse you need the morning after pill. But what if someone, what if a young lady has what is referred to as an irregular cycle? So there's maybe there's some hormonal issues, and you're not sure. Sometimes the period come this month, the next month the income, and or it come twice in a month and things like that. What should she do?
In relation to the emergency contraceptions, right? Mr. Jeffrey, are you talking in relation to the emergency contraceptions?
Yes, I'm hearing you. Go ahead.
Right. So in a young individual, actually, where the menstrual cycle is quite irregular, right? Definitely you would need to ask them, how irregular is your cycle? When last was your menses? Are you keeping a menstrual calendar? Which is quite important, right? Very important. It is of note that actually if her menses is irregular and she do have unprotected sexual intercourse, you would definitely ask her, is that a wanted, unprotected? Was it wanted, or was it forced? Or does she desire to have a pregnancy? Patient does not desire to have a pregnancy, definitely you'd encourage them to have emergency contraceptions. But you still bear in mind letting them know that actually it can have possibility of at least 2% failure of having a pregnancy, because what it does, it slows or it delays the egg to be released. The time at which she may take it during the menstrual cycle actually may not or may be her most fertile days. But because of irregularity, you are not sure what days are irregular cycles. So to be on the safer side, you would encourage her, if she does not desire to have a pregnancy, to have the emergency contraception taken. Very important, you would also educate her, letting her know that actually she should be at least taking them within 5 days in between intervals, because normally sometimes what could happen, they could counter-effect each other and affect the mechanism of action. So you need to educate.
Okay, but how long after intercourse should someone come to get that emergency contraceptive?
All right. In case of the copper, the coil, actually, it's effective, very important, up to 5 days after unprotected sexual intercourse. That's 120 hours. In case of there are different types of oral emergency contraceptions which we use worldwide today. One is the Ulipristal, which is a 30 milligram tablet. It's effective up to 120 hours after unprotected sexual intercourse. And the levonorgestrel, actually, it's effective up to 72 hours after unprotected sexual intercourse. If these days passes by, definitely it's taking emergency contraception after this time frame is very ineffective. Can end up in pregnancy.
Okay. Now I heard something once, and I'm going to ask. I've heard that if a woman already has a child, the morning after pill will not work. Is that true?
If she's already pregnant, yes. Data and evidence up to 2019 has surfaced that actually if it does not have any effect on any existing pregnancy.
No, not on the pregnancy. In other words, so a woman may have already had a child. So she has a child. She's been pregnant before and gave birth to a child. But she doesn't want to have another one. And so she opts for the morning after pill. I've heard that a case like that, the pill would not work.
In this case, actually, 21 days after delivery, definitely pregnancy can reoccur because your hormones comes back to normal. So after 21 days, it has an effect. Before 21 days of delivery, no effect at all.
Okay, all right. So I think I have a better understanding of that, Doc, and I want to now move to the issue of or just before.
Wait.
Yeah. Mm-hmm.
I just wanted to strengthen what Doc said about the timing of the emergency contraceptive for the one pill. Like, for example, there's a 72-hour window, right? Mm-hmm. But it is 95% effective within the first 24 hours.
Okay. Mm-hmm.
It is 85% effective between 25 to 48 hours. And within 49 to the 72-hour mark, mm-hmm. it is 58% effective. So my advice would be to people, the sooner you get it, mm-hmm. the greater your chances are of the protection that it offers.
Okay, wonderful indeed. So I want to come to Dr. John now. Doc, one of the biggest thing now happening has to do with vaccination. Mm-hmm. And we've heard all sorts of explanations. In fact, today someone all the way in Canada said to me that they're doing their research, and they're not going to take it. Mm-hmm. And of course we're talking about COVID-19 here. Mm-hmm. As a physician, and we've heard different stories. We know that like everything else, no vaccine, most medication has some kind of side effect. We've heard about the issue of the blood clot with the AstraZeneca, rare blood clot. I think I need to say that's important. But what would you say to your patient as it relates to the vaccine for COVID-19, the AstraZeneca that we have here?
Well, this is what we have. Okay, I don't think we will ever get the Pfizer, mm-hmm. because when you think of the storage and all of that with the Pfizer, that's a whole different story.
Right.
Okay. First of all, let's look at why we have the vaccine.
Right. Mm-hmm.
Okay, because we want to create some sort of herd immunity. Okay, when we talk about herd immunity, what we're talking about here is resistance to the spread of an infectious disease within a population, and that is based on either you had the illness before or you got the vaccine.
Right. Mm-hmm.
I remember I was doing some research on chicken pox some time ago, and they said that in England long ago there used to be chicken pox parties. If one child in the neighborhood came down with chicken pox, they would just call up and have a little party and bring all the others. Mm-hmm. Because instead of having 2, 3, 4 people getting chicken pox sporadically, just bring them all, expose them. Mm-hmm. Everybody get it, we're done with that. Herd immunity. Just like that. Okay, so it's sort of similar. We're trying to get herd immunity here. We're trying to protect our people. Mm-hmm. The AstraZeneca is what we have. Mm-hmm. And as you say, we hear how much about clots and side effects. I have people asking me about the vaccine. If they have a rash on their skin, should they take the vaccine? Mm-hmm. If I'm on this medication, should I take the vaccine? If I go into a party and I'm going to have a drink tonight, should I take the vaccine? So just about any and everything. Mm-hmm. The word we need to get out here is that COVID is real. Mm-hmm. And COVID is a very serious disease. Regardless to what we hear, what we see on social media, it is a serious one. Mm-hmm. And the thing about it is, we have sort of dropped our guard here, I would say, because we have not had any serious infection in this country.
Right.
Right? When we heard the first death, okay, that was somebody who was complicated with a lot of other things. Right? We may have had a few cases, but we have not really had a serious COVID outbreak. Right? 1 or 2 little community spread. So we are okay. G for God, G for Grenada, we are protected. No, that is not really the case. And it's the aim of our health system to get people immunized so that we can have that immunity that we need. I understand that people would be reluctant, and part of it is some people are not fully informed, right? Because we get our information from so many other different places than where we should really get it. The social media is a big thing here, so this is what people are using. So I will strongly advise the people, get your vaccine. The side effects, people talk about the clots. Look how many morning after pills we're talking about. Dr. Ducreay, the morning after pill, are you not exposed to having clots?
Well, yes, you could have clots in patients who have high at risk, yes. Obese patients, yes.
Just like the oral contraceptive, when you read the package, the amount of things they tell you, clotting is one of those, obesity, smoking, and smoking, anything. You know, I remember doing USMLE, and they say whenever the answer for the question has smoking, smoking is the answer. So if you're a smoker,
yeah, that's the answer.
That's the answer. So if you're a smoker, you are at risk for clots, right? With the contraceptive, with just about anything else. So why make clotting a big issue with the vaccine?
And it's like, I mean, it's one in how much million?
Yes, and we said it's rare. It's rare. Okay, I have seen so many clots not related to the vaccine, not related to contraceptives, and we are able to treat them. If I have a patient with a clot, the patient could be treated.
Yes.
But you get a patient, not one, all we need to get is a couple, COVID, real serious COVID. And we're in major doo-doo in this place.
Yes.
So, we have to take into consideration the people who are the caregivers, right? Why would you want to drop your guard, be exposed, and take it home? Or take it to your doctor, take it to your nurse? It really doesn't make sense.
No, it doesn't. Not at all.
It doesn't.
Well,
I don't want to take all your answers. Let me have some questions for you.
No. I'm happy to say that I got my second vaccine today, and I feel great. And I want to say to my guys out there, I told you all before when I took the first one, what it did for me, and it has done it again. So guys, go get your vaccine. You don't know what you're missing. I told you before. Go get your vaccine. It is very, very important.
Mr. Augustine, I didn't think I got the memo,
You didn't get it?
No.
Oh, well. It's a man thing. It's a man thing. It's a man thing. It's a man thing. But on a very serious note, though, as it relates to the vaccine, and we hear those stories, and people, someone said to me, well, they're waiting on the one from Cuba. And you hear all these sort of explanations, and you realize that a lot of people, they're not informed, but they hear something here, they hear something there, and they go with it. And you get the feeling sometimes that people are confusing the threat. To me, the threat is COVID-19, not the vaccine.
Not the vaccine. It's COVID-19, because just about any vaccine you get will do what it has to do, right? Yeah, I mean, thus far, we have not had that much community spread of this COVID thing, but that could change. Any moment now, it could change.
Yes.
Look at Barbados. Look at Trinidad. Look at St. Lucia. In Barbados, all it took was a bus ride.
Yes.
And up to now, they're still struggling to recover from it. Could you imagine our little precious piece of Grenada here, if something should happen like that, what's going to become of us? as I explain to people, some people say, oh, the vaccine take, too much a short time to make because COVID is new. Yes, COVID is new. 2 years ago, we didn't know anything about COVID, but I liken it to going to a bar. I'm not a big drinker. I could only take one drink, right? But I go to the bar and I ask you for a drink and I tell you, choose something for me because I really don't know drinks, honestly, and I don't know drinks. So you recommend a drink for me, right? So you told me you're going to give me something fruity with a little what? At that point, is that when you go and start to brew the alcohol?
The
alcohol line up on the shelf looking at me. You have gin, you have this, you have whiskey, you have all kind of drinks that I don't even know about. It's there.
Right.
So let's use that as a base for our vaccine. Right now, you're going to give me the fruit. That's not when you go and start to plant the fruit.
No, definitely not.
Right? But it's, new fruit, so you're going to give me a trial of it. No, it's going to take a little while because you got to get it out of the freezer.
Of course.
You got to blend it up. You got to do what? And mix it up and then give it to me. I may take this, but I didn't tell you I'm allergic to pineapples, and pineapple is in it, and I may get a reaction. So this is like the vaccine. You make the vaccine, the base is there, you mix in your RNA messenger or DNA, whatever it is, and you put it in there, your spike protein, and you serve it up. Some people get reactions, some people don't, but the reactions are rare.
Right.
Right? The most common one is a little, soreness in the arm or maybe a little fatigue, and it varies from person to person. Everybody don't get the same reaction. Some people never get any at all. And they ask, well, I didn't get anything. Does that mean that my body am making the antibodies? We are all different.
Yes, we
are genetically different.
Right.
And some people have to lie down in bed because it make them feel mashed up. And a little later, I'll tell you something about that.
All right. So let's go to the telephone because the calls are coming. Let's see who's with us. Doctor in call, good evening.
Hello.
Good evening. Go ahead, please.
Yes, good evening. Yes. Is it true to say that if a woman is nursing her child, she is unlikely to get pregnant while she's nursing her child? If she has unprotected sex, she's unlikely to get pregnant while she's nursing the child. Once she's nursing the child, she wouldn't get pregnant. Is that a correct thing? Thank you.
Okay, thank you very much, caller. Doc?
Well, to answer this question, I must say nursing could be classified as fully nursing, meaning fully breastfeeding, extremely breastfeeding the baby every 2 hours. If you are fully breastfeeding, actually, yes, you can prevent pregnancies. But if you are breastfeeding intermittently, actually, you can have the risk of getting pregnant because the hormones comes back on stream. You having back your ovulation cycles, so you could get pregnant. But if it's fully breastfeeding exclusively, it indeed can prevent pregnancy.
Okay, thank you very much. We have another caller on the line. Doctor and call, good evening.
Good afternoon.
Yes, go ahead, please, caller.
Yes. Doc, I want to find out. I take my second injection Wednesday gone. And I am 73 years of age. And I take my last injection Wednesday gone. And I didn't have no reaction. But I coming down with a 4% the cold. And it making me sneeze a lot. Can I draw some rosemary in the morning and drink it? Think anything going to happen with me?
Thank you, caller.
Okay, well, I guess that one is for me since I got down the vaccine alley. Okay, so I'm happy to know that you took your vaccine at age 73. I commend you for that. Now, what is the 4%?
That's the cold they have going around.
Oh, okay, okay, that's the name of the cold.
Doc, you need to get in line with things, man.
I spend too much time.
Doc, you need to fall in line with
I spend too much time locked up inside that office looking after patients and trying to get them to take vaccines.
Right.
Okay, so I don't know of any reason why you should not be able to draw your rosemary or even your orange peel or your lime or your onion. You should be able to go ahead and do that. Now, it's interesting that she had the vaccine and she said she's coming down with the flu now. Now, I don't know if people listening or even you here remember last year at the heat of the COVID pandemic, we did not have the cold.
no cold at all. Yeah, that's
Right? I remember saying in the office, but wait, we stopped getting the flu, people not getting the cold. I did not see one patient with the flu. Right? The question is why?
right.
Right? And I can put it down to the fact that probably we have dropped our guards a bit. Okay, it's not that the flu virus wasn't around or the cold virus wasn't around, but you could not get hand sanitizer to buy because everybody was
Well, yes.
sanitizing. People were wearing their masks. Most people were wearing their masks. People were keeping the distance. We were spraying the doorknobs. We were doing everything. Nobody wanted to get COVID. Now, I stand and I look at the bus stop, nobody with mask on, everybody moving around, business like usual. Okay, and this is why I believe we are seeing this. People are, I'm seeing children, I'm seeing adults, they coming in with runny nose, runny eyes, soreness in the throat, because we're not wearing the mask. We take it off. Yes, I have my mask, they have it on. You see, they drop it under the chin and all of that. Your mask is to be worn like this. Nose, mouth.
Right.
Covered. Okay? Keep it covered. And when you go to take your mask off, don't pull it down. Take your mask off like this.
Right.
Right? Do not pull it down because the mask is serving a purpose. If we're thinking of COVID, right? And this, it's now, we heard in the news that it's airborne.
Yes.
And
yes,
it could
yes.
go on you. So when you pull, COVID is here, you pulling it down in there and you bringing it back up here. Take the mask off from the air, take it off. And do whatever you have to do, eat, do whatever, and then you put it back on. So to answer your question, my dear, go ahead, draw your rosemary. You should not have a problem. And keep your mask on. Wear your mask.
Let's go back to the telephone. Dr. and Call, good evening. Hello.
Yes, President, good evening. I have some doubts about the blood clot, and I'll explain what I mean by having doubts. Now, a person takes the second dose of the vaccine, and all right, you may remain home feeling sick. The probably goes to the casualty. You have to wait because somebody is there. How would it be determined? Well, okay, X has a blood clot, and I look at the blood clot as a disorder in the human function, like having something that other disease that he doesn't know about, because we don't know what goes on inside of us. And having taken the vaccine, all right, the blood clot comes up. As you say, it is rare. What would happen with such a person going to the casualty or and so on and have to wait? What would he or she be at risk while in casualty waiting? Let me have some explanation, please. Thank you.
Thank you very much, caller. Doc?
That's for me again?
Yes.
Okay. Well, we know that casualty or the emergency room is for emergencies. All right? And if you're having a clot, I don't think, unless it's one of these things where you get a clot that goes straight to the lung, bam, and put you out, right? Other than that, you may have symptoms. right? Even then, you may get shortness of breath. So once you go to the emergency room and you tell the nurse, the triage nurse or whoever, look, I'm having chest pain, I'm having shortness of breath, you don't sit outside and wait, as far as I know. Right? I have worked casualty and I don't ever recall a patient coming in with shortness of breath, chest pain, any sort of, thing like that, and they're left outside waiting. Now, generally, people, if you see blood, most people tend to get scared. So somebody might get a cut and it's bandaged and there is blood, and they think they need to be seen right away. You may not necessarily need to be seen right away unless it's an arterial bleed, where it's just shooting out blood and you need to look after it. But somebody coming with a clot will be seen. I doubt anybody will leave you waiting out there for hours before attending to you, especially if you go in and say, listen, I had my vaccine 3 days ago and I'm experiencing this, that, or the other. You will be seen.
Right, wonderful indeed. So the number, yes.
Pick up in to that, and working at the general hospital, knowing that blood clots are really rare, but they are quite fatal. Coming to the accident and emergency department, we do have a code, green, red, yellow. So we know that actually if you're having some chest pain, we would think basically maybe it's a clot. So we'll give you priority over other patients that can actually wait. I'm not saying that the other patients are not important, but actually clots, they can travel fast, they can cause fatality. Sometimes you have to be admitted, most times in intensive care units. So we'll definitely give you priority if you're having this kind of condition.
Dr. Ducreay, while you're with us here, let me just ask you this. Just to comment, and Dr. John did speak on it, but the issue of the vaccination and people's concern about this red blood clot. Maybe you can add your voice here.
Well, so far it is one of the adverse effects, and not that people should not be concerned. They do have a right, because we all have human rights. I'm not against the vaccine, and I'm totally 100% for it, and I would encourage the population likely to have it. But if they want to wait and find out some more research, it's all up to their choices. Yes, we do have blood clots, but vaccines is not the only thing that gives a blood clots. And many people today take the vaccines and you may not even get an adverse reaction. So I don't think that we should have a total negativity towards taking the vaccine, because COVID actually is real. And we need actually to combat it, because if not, it will combat us. It can succumb us to even death, poor economical growth, and other consequences and hazards. So I do think that we should all have a positive mind towards having the vaccines in our own times.
Thank you very much indeed, Doc. So the number 435-204, and if anyone has any additional questions. Okay, so let's go back to our telephone. Dr. and Call, good evening.
Good evening. Good evening.
Okay, caller, can you turn the volume of your radio or TV down and listen to us on your telephone?
Okay, thank you. That's better?
Yes, turn it down. Listen to us on your phone, because we're getting a feedback, so we won't be able to hear you well. All right.
I want to commend you for that program.
Thank you.
And the doctors, the pharmacists. I think if we get the information explained as how we just got it tonight, a lot of persons would definitely go for the shot, because I think Dr. Deborah and the other doctor did well, especially Dr. Deborah. People sat and listened, and she took it from the bottom straight to the top. And I think people are more enlightened. For me, I'm a lot more enlightened on what she said. But I have another question for her. A lot of people are worried about the underlying conditions, persons with that, if it would affect them and all of that. What advice would you give to someone or persons who are worried about living with the underlying conditions and the vaccine? Thank you.
Thank you very much, caller. Thanks a lot indeed.
Okay, thank you very much. Well, I'm happy to know that I broke it down, that the layman could understand it, and especially in the language that we are used to. Okay, with regards to the underlying conditions, we're talking about things like diabetes, hypertension, comorbidities that people will have. These are the people who really need to be vaccinated. All right, because you're diabetic, let's say. That by itself renders you immunocompromised to some extent. You're a sickler. You're prone to just about anything. So these are the folks that we will want to see vaccinated because your underlying condition, whether it's your heart condition or whatever, predisposes you to this. So you want to protect yourself. Okay, let us assume you are not vaccinated and I am. You come to me. Now remember, the vaccine doesn't prevent me from getting COVID, right? What will happen if I do get the COVID, it would be a milder form, as is said. So you come to me, I'm exposed, probably have just a little sniffle I wake up with in the morning, don't think anything about it. I put on my mask, my shield, and you come to me. You are not vaccinated. What can happen? Unknowingly, I could transmit this to you. What is going to happen? You have, let's say, diabetes, or you have a heart problem, or a kidney problem. You are going to become ill.
Or asthma, for example.
Or asthma, obstructive lung disease, any of those. And you become ill, and you succumb to the illness because your body already isn't strong enough to deal with this, because it's already dealing with the diabetes that is uncontrolled, with whatever it is. And you succumbed, and I had it, not realizing that I had it, pass it on to you, and you go. Or let us assume you are vaccinated and you come down with the COVID. I mean, we're opening up the country,
yes,
right? 48 hours quarantine if you are fully immunized. There is always a little slip through the crack. Okay, and there is no if and or but about it. It happens, no matter how safe we are. You lock up your house, you do everything, a thief could come in. Mm-hmm. Right? So we do the same. Somewhere along the line, some things slip. And you are vaccinated, you get a mild form, you take it home. Grandma have something, she gets it, she dies. Then you start to feel, oh Lord, I bring this home, and look, I give it to my child who is asthmatic. Now remember, we're not vaccinating under 18s.
Right.
And you have a child who is home who is maybe epileptic or asthmatic or something, and the child gets it and succumbs. So it's important. People are not looking at the big picture. Let us take everything out of this vaccine business and do what we have to do. As doctors say, the information, the timing, but the herd immunity is important.
What
if we can immunize as many people, then the chances are if one gets it, it wouldn't spread like a wildfire.
Okay, wonderful. Let's see if we can take one final call. Doctor in call, good evening.
Yes, good evening.
Yes, good evening, caller.
Okay, I have a question. The AstraZeneca vaccine, I got information that it was developed in India. I'm not sure if this is correct. Could someone correct me on that?
Okay, thank you.
No, I'm not finished. I just want to hear that first before I place the question that I want to ask.
If it was developed
in India. Uh-huh.
Okay, the lab is there. Okay, if we know it's the Oxford AstraZeneca. I'm not the expert in terms of where the manufacturing took place, right? We may have a lot of medications that are made, one place, that was developed one place, and the manufacturing company may be elsewhere.
Okay.
So, saying it was manufactured or it was developed in India, I'm not sure about that, but it was made there. And of course, India, as we know, have some of the biggest laboratories where it comes to manufacturing medication and other things. Right. So I'm not sure, what...
Okay. Now,
I guess there's a follow-up question to that.
Yes. The reason why I asked that question, or to get that clarification first, is because we hear of the spike that took place in India recently. And a lot of people is using that as their reason for not taking that particular vaccine. Now, I am saying because of the size of the population of India, we do not know how many of these people who are now affected by the COVID-19 has had their vaccine, because that information was not given to us. But obviously, if one knows that that vaccine was produced or manufactured in India, then there would be the big question, well, if that is the case, why is it that they are coming down with it? So then why should I take it? Can you just throw some light on that?
I am looking at it, okay? When you take into consideration the population of India and the conditions under which people live in India, right? As someone who have been to India 3 times, I mean, you'll be surprised. The very first time I got there, it was night. And I thought it was probably snow. The dust, the pollution, the everything that is there, okay? And the crowding, the overcrowding, and you know, most infections, crowding is, so you put overcrowding with poor air, with air pollution and all of that, anything could spread, right? And okay, let us assume the vaccine was manufactured there. Remember, this vaccine is manufactured and it is sent out to so many different countries, right? They may have vaccinated a big portion of their population, but the population is so big that you know, the spread, and it's just going, and even their system is not able to handle. So could you imagine if we should get an outbreak like that? Our population will be wiped out 100 times. Right? So I'm thinking it's not just that the people were not vaccinated. I am of the firm belief that the overcrowding, the pollution and everything, and the population, the volume is just a whole lot. And I wouldn't use that as a reason not to take the vaccine.
Okay, thank you very much, Colin. Thanks a lot indeed. Yes. All right. Doc, we're practically out of time. Yes, we're out of time. So I want us to just go back a bit, talk, just sort of brief us again on the role of the council. Mrs. Duncan will tell us about the pharmacist, and then of course we're going to engage Dr. Ducreay with our final thoughts.
Yes.
So
before you go there, I had one thing I wanted to say about the vaccine with the side effects, and so people are crying, and I always say we take the babies, when we get our babies, we take them to get vaccinated, right? We don't miss it unless you're one of the anti-vaxxers. You don't, but generally we all do. You leave the hospital, they tell you, inform the nurse that you are out. In 6 weeks you go for your postpartum check, and then you take the baby for vaccine. We don't ask a question, because we know the baby is going to get this, that, that. Nurse says, when you go home, mommy, put a little ice pack on the site where we give the vaccine. Okay, if baby gets fussy, give baby a little Panadol, whatnot. Some babies go home, they sleep the whole night, no problem. This is like some people who get the vaccine and they say, man, I should take this every day. I would sleep like a baby. Some babies cry whole night. No matter how much Panadol or Benadryl you give them, they're crying whole night. And this is us, right? Some of us, we go to sleep. Some of us, again, oh Lord, we cry whole night. No, baby crying whole night cannot say, mommy, my head hurting, mommy, this hurting. But we who could speak, we call in the neighbor, we call in auntie, we call, oh God, my head hurting me. Oh Lord, this hurting me, right? Indeed. And we complaining. So everybody hearing the complaints. So we know that this hurting you, that hurting you, I didn't sleep. Some say, oh, I slept well. If the baby could have done the same thing, the baby would have called all the other baby friends in the neighborhood and say, don't go for this thing, it's going to hurt you, it's going to this. So we have to look at it like that and just think of the bigger picture, think of the protection, and do what you have to do.
But you know, Doc, it's funny because I've spoken to a number of individuals who've taken the vaccine, different people, and I've heard about some of the reactions. And generally, in a day, they're okay.
Oh yes.
I recall when I took my first jab, about midnight I woke up. I felt a little feverish. I went under my covers. By 7 o'clock I was at work.
You were at work, of course.
So I got the second one today, and I feel better.
Yeah.
I feel better.
And
so,
if you get a little headache tonight, just take your Panadol and go to sleep.
Oh, definitely so.
Yes.
So, yes. So, Doc, just before we leave, the council is putting things in place, the regulations, of course.
Yes.
And that is to ensure
the health and safety of the population, to ensure that we're not getting substandard medication, to ensure that when we do get a medication, we can understand what is written on the package, that the pharmacist could understand what is written on the package. We want to keep in tune with international standards. We cannot be seen as loosey-goosey. There are some people who travel, they come here with a prescription and they go to the pharmacy with it and expect that it will be filled. If I give you my prescription and you go to the US or even Barbados, you cannot get it filled because I'm not licensed to practice there. So similarly, when you come with a prescription from overseas, it has to be done by a licensed pharmacist. And you're not coming with your thing written on a piece of paper telling me this is what I take, especially if it's a controlled substance. Right? You either come with the empty bottle with your name showing that it was prescribed for you, and you need it refilled, and I do it for you. So these are the things that we want to put in place, and these are the things that need to be put in place because it exists. It's out there, and it's a matter of protecting the population. It's not a matter of being mean to anybody or mean to the pharmacist. It's a means of protecting the population, lifting the standards, and ensuring that the best healthcare is delivered to the nation.
Yes, indeed. Dr. Ducreay, any closing words from you?
Well, yes, definitely. Looking forward to work very close with the council, since it is an open communicative medium where we want to upbring the standards of our prescriptions and our medications, and also have a close relationship with the patients so that they could understand better. Because sometimes they may be feeling that they are sick, they are ill, and we are very strict of our guidelines, but we just want to have safe practice, because sometimes a medication may be given, as Dr. John said, and it may be a different name, and an adverse reaction may happen to that patient down the road, as Miss Lydia said, and the consequences might be great. So we're looking in the future to build our guidelines with standards and work well with the council and have good care with our patients.
Thank you very much. So the final word is going to go to our pharmacist, Mrs. Duncan. So, you're a pharmacist for many, many years. I've known you in the pharmacy since I was that high. No, I'm only joking. I'm only teasing. I'm only teasing you. But now that the council, they're putting things in place to lift the bar, to take the profession to the next level. As a pharmacist, how is that going to help your profession?
Well, as a pharmacist, I think it's going to enhance the profession, and it's going to make everybody have one voice, so that when you as a patient come to the pharmacy, you expect to get a similar service across the board. It doesn't matter which pharmacy you go to, you expect that you're going to get that sort of service, because there's a standard by which we all operate under. So we're looking forward to having a good relationship with the council, and getting buy-in to what they're trying to do and what is taking place, and the movement and the upgrading of our profession. And we will converse with the stakeholders to make sure that whatever it is that's being brought forward by the council is in agreement with everybody, and everybody's on board with it. And we just would like to beckon for cooperation and understanding in the matter. And I think at the end of the day, we will see and that it will benefit us as well as our patients. And that's what we would want.
Right, wonderful. One final word from Doc here. In all of that, what would you say to the patients out there visiting pharmacies?
Okay, I would say to the patient that your safety is of paramount importance. All right, so you may not go to your doctor, you may go to your pharmacist. Your pharmacist is confidential. You can speak with your pharmacist. You can seek advice. They're there not only to dispense, but to educate you as well. And if your pharmacist should give you a particular instruction based on a prescription, or they advise you to see your doctor, then maybe you should do so. Because remember, at the end of the day, we are all working together for the best interest of the patient. Okay?
Thank you very much, Doc. That's all the time we have, folks. We've gone over by a little bit, but that's all right with the kind of information that we've been disseminating. Thank you all very much for staying with us. Doc, thank you so very much. Mrs. Duncan, I thank you very much. Dr. Ducreay, I thank you very much for accepting the invitation and being here. And rest assured, you'll be hearing from me very soon. You'll be hearing from me.
Welcome.
Yes, indeed. So again, thank you very much. And Dr. John, I am looking forward to hearing of the work of the council. Yes. And of course, this platform is available to put information out there for the safety of everyone. Wonderful. Thank you very much and have a good night.
Okay, have a good night. Thank you.
Yes, indeed.
Thank you, viewers.
Thank you very much, folks. That's our program this evening. It was indeed a pleasure as always. Don't forget to join us tomorrow at 8 o'clock for our special edition of Release It, where we deal with the issue of treating as cited in the People's Representation Act. All right. Our guests will be attorneys at law, Miss Cara Shillingford from Dominica, also Miss what's her name from England. Her name left me, but she will be with us. She was the attorney that was very much involved in the Windrush case. She'll be with us as well, together with Mr. Ruggles Ferguson and Mr. Joseph Lane. So don't forget, tomorrow 8 o'clock right here on GBN K105, GBN TV, Facebook and YouTube channel. Until then, do have a good night. All the best.
Drug abuse, cancer,
measles,